Hello, and thank you for joining us to celebrate Occupational Therapy Month.
We want to thank our occupational therapists throughout Paragon for their hard work and dedication to helping rehabilitate our patients.
We spent the month of April holding events and games that were OT related and made sure that our occupational therapists knew how important they are to us.
Let's check in with some of our OTs and get to know them a little bit better.
Hi, everybody. Thank you guys for being here. Can you please introduce yourselves?
Hi, I'm Monica. I'm a certified occupational therapy assistant, and I work in the neuro program with our neuro patients.
Hi, I'm Emil. I'm a COTA, licensed under the state of New York, and I've been here for 20 years.
Hi, my name is Beth. I'm a CODA licensed. I've been here for 12 years.
I'm Rosemary Drummond. I'm a coder. I've been here for I think 4 or 5 years.
Very nice. All right, I'd love to ask you guys a few questions. So, can you please describe to me what occupational therapy is to maybe someone who's not so familiar with the discipline?
So what I explain to people, and often they don't understand what a CODA does, is it encompasses working with folks to be safe and functional in their everyday life from the minute they wake up to the time they go to sleep. So being able to sit up out of bed and get dressed, toileting, eating, dressing, getting ready for bed, grooming and hygiene, and anything specific to that person because everybody's individual. So there might be different things that people like to do, whether it's going out and, going to a day program or going grocery shopping, working with, out in the public with society. So it's different for everybody, and that's what we focus on. It's very person-centered and safe and functional activities, and we just work with them to get to that level.
Love it.
The prior level of function as well. We really, that's what we all do and we love to do.
Thank you.
Yeah.
Thank you. So, what got you into the field of occupational therapy? What was the draw?
The draw was I was tired of manual labor. I was doing construction work and what have you, and a friend of mine who was an OTR recommended that I should try it because she said I had good social skills, which is what you need in order to do this job. So at the age of 33, I went back to school and became a coder. And I just love working with people. And I love using my ability to really read people and know the ones that I can joke with and the ones that I need to be a little more serious with. So
very personalized experience.
Yeah, I feel like I've had great success with it, and there's nothing better than seeing someone able to go home, after after an illness and being on their own and taking care of themselves. That's something special, and a lot of jobs. You don't get that. You don't get that reward.
Yeah.
Like we experience.
True.
Yeah. Sounds like a good choice then that you made.
Yeah.
I love that. So, what do you love about being an OT?
Like Emil said, I love helping people. I love seeing them go back to the way they were, what's important to them. Occupation meaning like their occupation of life, what they do in their life, what's important to them. As far as their leisure, their ADLs, being with their families. So that's what really drew me into it, and I just love being able to help all different kinds of people and all different kinds of conditions. And it's very fulfilling and very rewarding at the end of the day to to know I sent somebody home and that they're with their families now.
Thank you. That's great. So, do you have any memorable moments in your career that stick out to you?
Okay, that's a really hard question to answer because I have so many memorable moments, and just to put it in a short phrase is very difficult for me, but I try my best not to take up the whole time discussing it because I'm doing this for 20 something years and I have many memorable moments. one of my most memorable moments is working with a patient, and it was like really medically declined, and it's like nobody thought he would pull through. And I went there, and all I started was to encourage him to push a little harder, do a little more, and you can do better than what you're doing, and just encourage and helping him. And he was able to pull through after everything, and he survived and came back here to say thank you, Rose. He's also one of the one there's 100 deep divers who went and see the Titanic ship, and he was one of them.
Really?
And he autographed his book and bring it back and give it to me and said, thank you so much, because if it wasn't for you, I wouldn't be around. And when he said that, it really touched my heart. So that's one of my most memorable moments. And there's a lot of others, but I don't want to take up the time with that.
That's incredible.
But I just remember that each time, and that motivates me every single day to walk in the building and help somebody, because I realize that even small thing you might do for a person, you just do it because you want to do well, but you don't know what really stay with that person and make a big difference.
Yeah.
There's nothing better than having somebody walk into the building and thank you for giving them their life back.
Yes.
I mean, what other job
Yes.
can you think of that can give you something like that?
I agree.
And even the family said, yes, Rose, I'm really happy with what you did, because I wouldn't have my family member back. And I keep remembering that.
Thank you for sharing that. And thank you all for all of the work that you do. You guys really change lives, and you're amazing. Thank you.
Thank you.
Thank you. Thank you.
Our neurological rehab team faces unique obstacles working with individuals with brain injury. Our occupational therapists rise to the challenge to help our patients regain their function and independence.
Thank you for joining us today to celebrate our amazing occupational therapists. Remember to take care of yourself so you can stay as functional as possible for as long as possible.